Assalamu alaikum, dear viewers. Once again, welcome to my new lectures. So, starting with the name of Allah, the most beneficent and the most merciful. So, today my presentation topic is on antidote. So, what are antidotes? Antidote is a substance which counteracts the effect of the poison. So, I mean, whenever there is poisoning, let's suppose a poisoning occur, so in order to reduce or minimize the effect of the poisoning, certain antidotes are used. Types of antidotes. Types of antidotes. There are different types of antidotes. These are mechanical and physical antidotes. These are chemical antidotes, or these are physiological and pharmacological antidotes. Mechanical and physical antidotes are those antidotes which act by minimizing the absorption of the poisons. So, for example, that is demulcents for the corrosive and irritant poisons, and activated charcoal are used for alkaloid poisoning. So, I mean that whenever there is occur alkaloid poisoning, so activated charcoal can be used. In case of irritant poisonings, demulcents can be used. So, I mean, to minimize the poisonous effect of any substance. Chemical antidotes are the type of antidotes which act either by chemical neutralization or formation of non-toxic complex with the poisons. So that may be in the form of chelating agents and heavy metal poisons, acetic acid and vinegar for alkali poisons, magnesium oxide for acid poisons. So I mean that when, for example, when heavy metal poisoning occurs, so chelating agents can be used. In case of alkali, in case of acetic acids and vinegars, so for alkali poison, acetic acids and vinegar can be used, and for acids poison, magnesium oxide can be used. The physiological and pharmacological antidotes. These antidotes produce physiological effects which are opposite to that of the effect poisons. For example, atropine per organophosphates and nalorphine per morphine. So the simple question or the simple solution is that whenever there is organophosphate poisoning occurs, so atropine can be used. In case of morphine toxicity or its overdosings, nalorphine can be used. Dear viewers, you can see here, especially on my screen, the list of some poisons and their antidotes. These are the poisons, or these are the drugs, or these are the antidotes. So in case of overdosing or in case of toxicity, we can use any kind of antidotes. In case of paracetamol, we know that paracetamol, it belongs to the non-steroidal anti-inflammatory drug, and you know paracetamol is a drug of choice for fever, which is also called acetyl salicylic acid. So in case of paracetamol toxicity or its overdosing occurs, so acetylcysteine and methionine can be used. In case of in case of opioids toxicity, naloxone can be used. In case of anticholinergics, so cholinergics can be used. So these are the poisons. So if you remember, we have already discussed, if something is taken in a large quantity, so it become poison. So drug may be poison if it is taken in a large quantity. So definitely, if the medicine they are taken in a large quantity, so it become poisons. In case of organophosphate poisoning, so atropine and pralidoxines can be used. In case of heparin poisonings, we can simply use protamine sulfates. Protamine sulfate is one of the best antidote which can be used to reduce the toxicity of the heparin. In case of iodine toxicity, starch can be used, which is polysaccharide. In case of heavy metals, chelating agents can be used. In case of benzodiazepine and barbiturates toxicity, plomazenil can be used. So plomazenil is the antagonist or antidote against benzodiazepine and barbiturates toxicity. In case of vitamin K, anticoagulant like warfarin, which is anticoagulant, it prevents the blood from coagulation. So the antidote is vitamin K. In case of isoniazid, which belong to antitubercular drug, its antidote is pyridoxine. different factors that affect the poisonings. These are age, location and time responsible for the family, accessibility to poison container, individual psychological state, society and legal approach. Especially the children or teenager whose they have reported 70% of the children they are affected by the poisonings. Adults, 30% of the cases reported in the adults, especially in case of poisoning. Accidental poisoning is rare in children below 1 year age, but occurs by immediate elders or by parents without knowing its danger. It may be vulnerable ages 1 to 3 year old. 46% of the children are within 5 to 6 year old. 9 to 15 years old children take poison due to emotion. It also depends upon on the location. 80% accidental poisoning among the children occur at the home and home premises, of which 62% at the kitchen, washroom, bathrooms, bedrooms and family automobile, etc. And bedrooms poisonings occur especially at afternoon when the parents and the elders take rest. Common poisons are kerosene and medication. The poisoning at the bathrooms may occur any time. Cleaning agents are the culprit both in the kitchen and the bathroom. So in the kitchen, the poisoning usually takes place at late morning or just before lunch. Response from the family, incidence of the, this is another factor, this is the third one contributing factor which is responsible for the poisonings. Incidence of poisoning occurs due to lack of consciousness of the family about the site leaving poisonous or toxic material of household used like insecticides, kerosene, medicines, cosmetics within the reach of the children. While hosting, some relatives or guest family members remain busy and childhood poisoning may occur. Accessibility is another factor which is responsible for the poisonings. Medicine, insecticides, cosmetics, all these are poisons. If these are not kept in lockers or out of reach of children, may cause poisoning. Poison container, removal of potentially toxic material from their container is a significant cause of accidental poisoning, such as keeping kerosene in the soft drinks bottle. So I mean that you must keep kerosene in the soft drinks bottle. Individual psychological state, this is also one of the contributing factor. So when someone is in love, emotion and frustrated stage. So another one is society. Socio-economic status and lack of social control is also one of the leading factor of poisonings. Legal approach, this is another factor. You can say the Poison Act and listing illegal drugs and government controls. Prevention of childhood poisoning. How the childhood poisoning can be prevented. To prevent the childhood poisoning in case of any type of medicines, you should keep away, close the container immediately after using. Use the child resistant packing and keep it out of reach of children. So keep the pills in their original container. So it is also necessary to keep the irons containing tablets and all the medicine out of reach and out of sight of children, because the child attracting medicine should be kept out of reach and out of sight of children. Never keep medicine on a countertop or bedside table. Follow medicine label direction carefully to avoid the accidental overdose or mixed doses that would result in accidental poisoning may be occur. So these are the preventive measures and must be adopted, especially in childhood poisoning. Advice is for hazardous products. Never transfer these substances to any other container like the milk cartons, water bottles and soft drink, etc. Don't store any medicines in kitchen or washroom. Potentially poisonous items should be locked in the cabinet, and after any accidental poisoning at first and call the doctor and take advice, and then take the person being poisoned to the hospital immediately. Now, what is the role of the pharmacist in the prevention of the poisoning cases? So it is our morals, social and ethical responsibility to bring awareness in the community. So community awareness about the consequences of the drug abuse. So we should also blocking the production of the poisonous material and to conduct the continuous basic health education program. So we should also do counseling the individual and his or her family, and making and implementing the poisoning act and poison control legislations. So I mean that pharmacists play very vital roles in the especially in the personality development of any individual. So it becomes the responsibility of each and every healthcare provider. So being a healthcare provider, so it's our social responsibility to work on it and bring awareness in our community. So thank you so much for watching my lecture. So if you have any question regarding this lecture, I am always available for any kind of services. If you need these contents in soft form, so you can directly email me, so I will share all this content with you, which is very beneficial. And the main aim of this lecture is to bring awareness in the society whenever you see such kinds of situations in your society. So you all are responsible to overcome on these kinds of problem. Thank you so much. Wish you all the best. So if you didn't subscribe my channel, so please kindly subscribe it and press the bell icon for my upcoming lectures. Thank you.